Shingles, otherwise known as herpes zoster, is a reactivation of the virus that causes chickenpox. Starting in the 1990s, most children have been routinely immunized for chickenpox with a vaccine. Prior to this, the majority of people acquired the actual chickenpox virus. And for those that experience chickenpox, there is a risk of the virus coming back in the form of shingles, and that's what we're talking about today. The major updates in shingles are with regards to vaccines. In 2006, a shingles vaccine called Zostavax emerged to help prevent shingles and its complications, and is what's known as a live attenuated vaccine, meaning it's not completely dead, and therefore there is a theoretical risk of getting the infection from the vaccine itself. So, since it's been out since 2006, for the past 10 years or so, there was this concern for patients who had a rheumatic disease on high doses of immune-suppressing medications that they could get the infection. However, recently at the 2019 American College of Rheumatology annual meeting, researchers reported Zostavax is safe for people who are currently receiving a class of medications known as tumor necrosis factor inhibitors, or TNF inhibitors. And this study was a big deal. These medications are biologic therapies used to treat a whole host of different rheumatic diseases such as rheumatoid arthritis, psoriatic arthritis, and many others. There are 5 different TNF inhibitors approved by the FDA. These are adalimumab, infliximab, etanercept, golimumab, and certolizumab. The name of the study was called the VERVE trial, and this was a randomized control trial of more than 600 individuals in the United States receiving TNF inhibitor therapies. Now, the goal of the study was to evaluate how safe and effective Zostavax was in these patients who might have a not normal immune system due to their TNF inhibitor treatment. The majority of these patients either had rheumatoid arthritis or psoriatic arthritis. And what the researchers did is they gave Zostavax to these patients and watched them over a period of 6 weeks. And at the end of that 6 weeks period, they said, okay, well, who developed shingles during that time? And at the end of the day, 0 patients developed confirmed shingles. Thus, this provided evidence that Zostavax is safe, at least in this particular patient population. Now, that being said, in 2017, a new, different vaccine called Shingrix was released that is more than 90% effective in preventing shingles and its complication, Postherpetic neuralgia, and at this point is the preferred vaccine recommended by the Centers for Disease Control, or CDC. Adults over the age of 50 are approved for the vaccine, and it is given in a 2-shot series administered 2 to 6 months apart. Now, Shingrix is different from Zostavax in that it is a dead virus, and thus there is no risk of getting the infection from the vaccine. However, in order to make the vaccine effective, it contains what is called a strong adjuvant. Think of that as an immune stimulator. And the purpose of this adjuvant is so that your immune system will better recognize the vaccine and thus provide long-lasting protection. But because of this, Shingrix can produce a strong response from your immune system, so it may produce short-term side effects that are a little more intense than you're used to from other vaccines. These side effects can be uncomfortable, but they are expected and typically go away on their own in about 2 to 3 days. Of note, even if you've had the original shingles vaccine, Zostavax, you can still get Shingrix. And if you had shingles before, you should still get vaccinated. Shingrix is covered by most healthcare providers and most healthcare insurers, but you should still call your insurance company just to make sure you don't have a lot of out-of-pocket expense. Lastly, although approved for those over the age of 50, there are some individuals that are younger than 50 who are at high risk due to their specific disease or the treatments they're receiving. So they should speak with their rheumatologist on the utility of receiving either Zostavax or Shingrix. That's all for now. Thanks for watching.